As a physician at Park Avenue Medical Professionals, I take care of dozens of patients per week who come in with a variety of diagnoses. Many require different types of testing in the form of blood, radiological, and other types of testing that and sometimes have to be sent out for consultations with other physicians. Until a few years ago, we were bogged down in paper charts and manual superbills, having to hand out written prescriptions and manually sending faxes. We were running out of space in the office due to the paper overload. That all changed when the practice adopted the Medix EHR from Advanced Data Systems. Implementation was easy, training was thorough, and we were off to the races on EHR. The Medix EHR transformed us into a new level of efficiency, appreciated by our physicians, staff, and most importantly, our patients. The workflow was so much smoother. Patients arrive for their appointments, they're electronically checked in, and the whole office is aware of their arrival. All prior results are in digital format on a readily accessible tab across the page. We can access prior results from procedures and labs. We can send electronic prescriptions and digitally communicate with patients and their referring physicians. We can even process the billing of the superbill electronically to the Medix practice management system while the patient is in the room for quick processing to the patient's payers. The system includes mobile accessibility records and the ability to send electronic prescriptions in the palm of my hand. For this accessibility, we have received so much positive patient feedback. The Medix EHR has revolutionized the way we practice medicine at Park Avenue Medical Professionals in so many ways, from efficiency of space and time to the more efficient workflow at the time of the visit and post-visit communication with patients. Another very important function is the efficiency of data capture to send detailed reports for quality measures, reporting mandates. I wholeheartedly endorse the Medix EHR system as a benefit to any medical practice.
Park Avenue Medical Professionals is a multi-specialty practice in the Upper East Side of New York City. As the manager of this practice, it is crucial that an efficient practice management system is used, since our patient volume is in the thousands and we rely heavily on automation. In 2003 until 2012, the practice used software that was no longer supported by the parent company and was not certified. We had no option but to transfer to a new system. The second system was so cumbersome that the physicians struggled to keep up with the charts, and we were losing revenue. The Medix practice management system is actually user-friendly and can handle high volumes of EDI, accurate claim tracking, reporting, and analytics. It has the capability in maximizing our revenue cycle with its denial manager. The system also has the ability to separate different tax IDs into entities, which allows us to stay on one window without the annoyance of having to click from one screen to another. We love that the account inquiry seems to mimic Excel. The ADS system is very, very user-friendly, and ultimately we found it to be cost-effective. Training of new employees is not dragged out, and information is always readily available at our fingertips. Our users don't have to hunt all over for a specific piece of information. Whatever is needed generally appears on the window being worked in, or is no more than one click away. We value how the system really does help us capture every maximized dollar for every patient visit, to the point where we know each patient's insurance has been verified even before they arrive for their appointments. Medix has produced an incalculable return on investment. One factor that adds to our satisfaction is ADS customer service. It's a company with knowledgeable people and can always be relied on for assistance, suggestions, and advice. Sometimes even a bit of hand-holding. Without a doubt, ADS and their Medix suite represent the ideal combination of company and software.